This is Healthcare Today with your host, Kelly Roberts.
Welcome to Healthcare Today. Today we're here on location at Southern Spine and Health, Quick Fix Family Convenient Care and High Energy. I'm first joined by my first guest, Dr. Dixon Cotton. Thank you for letting us be here today.
How are you doing today?
Good. I appreciate you letting us come over and be a part of this today.
Yeah, I'm glad you came.
Now this is something different that Southwest Georgia hasn't seen a lot of. So talk to me a little bit about what all is available right here at this location.
That's right, Kelly. At this one location, we offer Southern Spine and Health, Quick Fix Family Convenient Care, and High Energy Weight Loss.
Okay, so that's kind of a collaborated effort, a lot of different things going on.
It is. As a multidisciplinary healthcare and wellness center, we offer chiropractic, massage, and a convenient care.
Okay, and then the Quick Fix Family Convenient Care, that's something totally different.
It is.
Tell me about that.
With the Quick Fix Family Convenient Care, we can treat any non-life-threatening conditions ranging from minor aches to flus, suturing, taking x-rays, just anything.
Okay, and then you have high energy weight loss, which is another great added benefit at the same location.
Yes, High Energy just joined us, and it's a weight loss program.
Okay. Now, you are very familiar with the medical community here as you were born and raised here and came from a generation of medical providers. Tell me a little bit about your story.
Yes, my dad was an orthopedic surgeon here, Dr. Bennett Dixon Cotton. He practiced here for over 30 years. He passed away in 2013, and originally our plan was to start this practice, but we kept this dream alive.
And here you are today. And this is a little bit different probably than that we talked about. It's so neat that you have different areas here at one location. How convenient is that for your patients?
It is. Chiropractic and orthopedic is similar. We're both treating musculoskeletal problems.
Okay. All right, we're going to take a quick break. Stay tuned and we'll be right back.
No one has time to get sick, and no one has time for long waits. When you feel bad, you want to feel better now. Introducing Quick Fix Family Convenient Care, the most convenient alternative to an ER, is right here inside Southern Spine and Health, offering a complete and full range of urgent care for you and your family. Whether it's allergy care, flu shots, x-rays, DOT physicals, stitches, or overall wellness that you need, there's no better option than Southern Spine and Health.
Welcome back, and once again, I'm here on location at Southern Spine and Health, Quick Fix Family Convenient Care and High Energy. My next guest is Dr. Bradford Cotton. Welcome.
Thank you.
Thank you again for letting us be here in this beautiful facility.
Absolutely.
We were talking to your brother previously, and I think it's wonderful that y'all two had this vision of creating a health and wellness center like this right here in Albany, Georgia. And he was telling me a little bit about this actually wasn't necessarily y'all's dream, but your father. So talk to me a little bit about that.
Well, right after we graduated at Auburn in 2009, we kind of came up with this plan of one day opening a practice, a multidisciplinary practice like this, and finally we got it opened, and it's been a wonderful thing.
And I was telling your brother it's so great that y'all are carrying this on in his memory, knowing this was his mission and he liked this.
Absolutely. He would love to see it now.
And he instilled a lot of great qualities about patient care with you.
Absolutely. I remember from a young age just being with him. He'd take me to the hospital to go make rounds with him as a little kid, and just seeing his bedside manner and see his interactions with patients and just how he instilled his patient interactions really been a really good thing that's helped me out a lot.
You feel like that's helped you become the physician that you are?
Yes, ma'am, absolutely.
Great inspiration. And now, talking about this is new and different. You don't typically walk in, one place and find such different levels of care here. How beneficial is that for patients?
It's very beneficial. It's a different approach to healthcare. It's kind of a new concept. You know, especially with chiropractic care, collaborating with medical care, you know, it's got two different approaches.
How hard is it for patients sometimes to become that first-time chiropractic patient?
It's very easy. Patients, you know, getting in, it's very easy to become a patient here, getting seen. We can get patients in usually same day. You know, from start to finish, you know, it's easy access for chiropractic care, also medical care, and also if they need weight loss, because that also correlates with a lot of people's spinal problems.
Okay. And people sometimes might be hesitant if they've never seen a chiropractor before.
Right.
So let's talk about that, help ease their mind.
We get a lot of hesitation, you know. A lot of patients at first have never been to a chiropractor, and we kind of explain it to them. We're trained in a lot of different techniques, the latest and newest advanced chiropractic techniques. So we correlate our care to meet the patient's needs, whatever the patient's needs and their body can handle is what we go with. We kind of come up with a care plan. We collaborate, my brother and Ron and myself, and we get together and come up with the best care plan to get the patient getting back to where they want to be in their life.
Okay. And then once you've kind of, I mean, for some patients, is it follow-up good? You kind of advise them as they come, I imagine you have some patients that come to stay
Absolutely.
healthy and not having the
Absolutely.
back pain, the neck pain.
Right. We get a lot of patients that come just for preventative care. We get a lot of athletes, people in CrossFit, you know, people that are active, that just want to keep their body moving and just want to prevent injuries and, you know, keep their spine healthy.
And how important is that? That brings up a good point for people not to wait. If something's bothering them, because, you know, most people probably tend to wait till it's really bad. What's your advice?
Come on in and get checked and go ahead and get it taken care of before it becomes too much of a problem.
Much of a problem. Okay, we're going to get some more details from Dr. Register next. We're going to take a quick break. Stay tuned and we'll be right back.
No one has time to get sick, and no one has time for long waits. When you feel bad, you want to feel better now. Introducing Quick Fix Family Convenient Care, the most convenient alternative to an ER, is right here inside Southern Spine and Health, offering a complete and full range of urgent care for you and your family. Whether it's allergy care, flu shots, x-rays, DOT physicals, stitches, or overall wellness that you need, there's no better option than Southern Spine and Health.
Welcome back, and once again I'm on location here at Southern Spine and Health. I'm now joined by Dr. Ron Register. Thank you for sitting down with me.
Thank you for having me.
I was previously talking to some of your partners, and we started talking a little bit about chiropractic care and how it's a little unique here. But talk to me about what a patient can expect maybe on their first visit.
Sure. Our new patients always get a thorough exam, and we take their history, try to find out what's going on that could have caused the issues that they're having if they are having pain. Although not all chiropractic patients need to come in because of pain. We actually are a preventative measure as well. So we try to have patients come in to prevent having any issues or pain. And but those that do have issues, we try to figure out what's going on with their past, if they've had any trauma, accidents that could be related to the problems that they're having, and then treat based on what issues they were having.
Okay, and I would imagine there's different techniques you use for different patients.
Oh, absolutely. We have a number of different techniques that we use here, not just manual adjusting. We use instruments. We have Activator, which is a little tool that we use, as well as ArthroStim, other instruments, and we use the table a lot. So we let the table do a lot of the work. The table actually pops up, and then on the drop is when the adjustment's made. There's a lot less impact on the patient, and a lot of people like that. We also do manual adjustments, so that's something that a lot of people like as well. But we have a diversity. We have a different way of doing things. In addition to the instrument adjusting, we have other tables that we use for what we call Cox, flexion distraction, which is where the table again does the work. It drops down. We stretch out the lower back, open up the the discs in the low back. We do a lot of decompression or traction therapy, and we do a lot of other techniques here that some other chiropractors may not.
Okay. And so how, now the beneficial, do want to talk about this, the tables and the things that you say are kind of, a little unique in the things you use. Do patients sometimes feel that instant relief, or is it determined on, what they're here for?
Sure. Yeah, a lot of patients have instant relief. You always hope to have that one pop, that one adjustment that fixes everything. That's not always the case. Sometimes it's a matter of repeated treatments. Some patients come in and it is that one perfect adjustment that fixes whatever they had going on. But for a majority of folks, it does take a couple times. You didn't begin to have this issue in one time.
Right.
So you're probably not going to have it fixed at one fell swoop either.
So it's probably still very fearful for a patient maybe that's never seen a chiropractor before, or maybe they've heard, and bear with me, that you've heard a pop, a snap, and that may intimidate someone. Talk to me a little bit about, people don't need to be anxious about that.
No, not at all. We always try to work with the patient to do whatever kind of treatment is going to be the best for them. Some patients, we don't do any kind of manual adjustment, which concerns people. And some patients, they realize as we talk to them and ease their fears that, that it actually would be the best treatment for them. And over time, they grow to really enjoy that. So,
and I like you mentioned preventative, and Dr. Cotton previously mentioned a little bit about that. But so if you're that golfer that knows maybe after you play 18 holes, 2 days in a row, you have that in your bag, so what's your recommendation for them to be proactive?
Yeah, absolutely. I think everybody should be adjusted. Now, I'm not saying you have to come into a chiropractor, 3 times a month. I mean, I'd love to see you, but I think that you should come in at least a couple times a year. Some people come in a good bit more, but you should be checked just like you're checked by your other healthcare professionals on a regular basis. It helps prevent any kind of future issues. So like your golfer or somebody of that nature, if you have a regular spinal adjustment and make sure everything's in alignment, you're at your best form and you're able to perform at your best, and you are often going to be able to prevent having back pain or other issues.
And for many patients that may be not happy having to take medication to treat, as you mentioned, symptoms, but they've not maybe gotten to the reason, is this a good option?
Sure. Yeah, there's a time and a place where medications, medicine, everything is very much necessary, and we're an integrated practice here, so we're aware of that. But for those people that want to try to avoid that, use a more natural, holistic, avoid getting involved with the pain medications, anything like that. If you are in pain, chiropractic is definitely an option that may be able to help you deal with that pain or alleviate it.
And how does massage therapy play into some of your treatment options? You offer that here as well?
Sure. So massage goes along with everything else that we do here. I mean, as a chiropractor, we find that a lot of people have tight muscles, and it just really helps with our adjustment to people get massage. They relax, they adjust better, in the same way that we are integrated with everything else. So the medical side, if somebody is hyperacute, needs a little bit of medication to get them by until we can make our adjustments, get them feeling better, we can do that. At the same time, with medical weight loss, so many people's back pain is because they're carrying a little bit of excess weight.
Right. So it's a great overall plan that you can encompass a lot of care. Great. Well, some great information. I appreciate you letting us be here today. We're going to take a quick break. Stay tuned and we'll be right back.
At High Energy Medical Weight Loss, everyone has different motivations to lose weight. Whether you have medical issues or just want to lose a few pounds, here are some of our success stories.
Joe and I had gotten to a point in our life where we were tired of being overweight and not feeling good, just not being healthy. I decided to go to High Energy. I had a lot of friends that had a great deal of success with it. We both lost over 30 pounds.
And so if I can do it, anyone can do it.
Call or come by High Energy so we can start your own success story.
Welcome back. Once again, I'm on location here at Quick Fix Family Convenient Care with Deanna Gilmer, nurse practitioner here at the Convenient Care Clinic.
Yes, ma'am.
Thank you for sitting down with me. Now, what's neat about this is you treat patients, adults and pediatrics here. Talk to me a little bit about that.
I am a family nurse practitioner, so that allows me to treat members of the community of all ages. I see pediatrics, teenagers, young adults, even geriatric patients, which are your adults 65 and older. So I'm able to treat the young and the old.
Okay, and what's really neat about here is you have a lot of the things that probably may prevent someone from having to go and sit with longer wait hours, but you do labs and x-rays and things like that here?
We do. We do have the capabilities of drawing labs. Now we do outsource to other facilities for the results, but majority of the time we get our results next morning. Okay. So it is a quick turnaround. We have x-ray capabilities. That way we can differentiate between sprains, strains, and breaks. Okay. If we do recognize that there's a fracture, we do refer out though. Okay. In addition to that, we're able to utilize our Southern Spine and Health chiropractors, which is wonderful for some additional stuff, as well as massage therapy, depending on our findings.
Okay, and so what's neat about Convenient Care, it is convenient. You can walk in here should you need something right away. Talk to me a little bit, y'all are open daily?
We are. We are open 7 days a week with differing hours, depending on which day. But we're here majority of the time, 8 o'clock in the morning, and then after hours for when people get off work.
And with pediatrics, that's so convenient because anybody who has children knows that they will never be sick at a convenient time.
No, majority of the time it's weekends, all the times when you're least expecting it.
Right, or you picked them up from school and now it's 5:36 and they need to be seen.
Yes, most definitely. Always going to be whenever nothing's open.
Okay.
So, and we allow for, walk-ins at any time. You don't have to have an appointment, which makes it very nice for people. You don't have to be an established patient. We take new patients at any time.
Okay, and it is hard sometimes for patients to differentiate, like what is convenient, like what do I need? But if you have something that's just been like a nagging problem, maybe a cough or a cold, it doesn't necessarily have to be an emergency to come in.
No, not at all. We can treat anything from, a cough, cold, flu. We do have flu, strep, mono test, anything that's point of care. Right here, right now, we can test for. Those acute things that are going on in the community right now. That's very active. We keep hearing about how bad the flu is. And it is. It's everywhere.
So that's such a benefit that you can test right here and then you know how to treat?
Yes. Being able to differentiate between viral and bacterial makes a difference in what our plan of care is.
And how does it benefit patients, I guess, seeing a lot sooner the minute they get sick?
Yes. Being able to be treated within the first 24 hours really does make a difference. A lot of times your choice of treatment will change based on how long you've had the symptoms.
Okay, and then you are accepting patients, like you said, you can come right in.
Yes.
Okay, and then what about if they do have a primary doctor but they need you on the weekends? You send notes, follow up, they stay in touch. How does that work?
We're not here to take you away from your primary care doctor. Right. We're here just to be an asset to whenever your office is closed. If you want a copy of your notes or if you want us to send anything to your primary care physician, we are more than welcome to do that for you. That way they'll know what has been going on, what treatments you've received, and that way they stay in the loop of what else has been happening.
And I keep going back to this about the pediatrics because especially maybe for new moms, 48 hours can be a big difference, especially when kids are at the age they can't maybe communicate with you. So you probably ease a lot of parents' mind by being that convenient resource?
Most definitely. The children can turn very rapidly. So being able to be here just to ease a mind is wonderful. Whenever they have just a little cold, it can sometimes be more than a cold or even obstruct their airway. So you never know whenever something really bad is going to happen. And new moms, there's nothing more than them getting upset, feeling like they're overreacting, but it's never overreacting when it comes to your child.
And you probably give that great level of comfort to them, like it's okay to come in and maybe they're happy to find out it's nothing to worry about.
That's always the best news. It really is.
Right. Yeah, and then they can follow back up with you. Should they go out with a course of treatment and you want them to continue to follow up if they feel bad in the next day like it is on a weekend. I guess that's an added if I see you late Friday afternoon, but by Sunday I'm no better. It's nice to be able to reach back out to you.
Yes, it's one of the reasons why when we were able to expand to extended hours, it was such an asset
Nice
to be able
have
to.
it here. And so as they come in, if someone comes in for the first time, what can they kind of expect? They just come in, sign in up front? Do you take a little history and physical from them? Or
We do. It's included in the new patient paperwork.
Okay.
So there is a little bit of paperwork to be done. Once that's completed, though, then we get you checked in and we get a set of vitals, and then you'll go on back to the room where we get brief current history of what you're experiencing, and then I come in and follow up with everything that's been going on, any medications you're currently taking, and then do your assessment.
Okay, and something good maybe for them to bring, like if they're currently taking medications, you'd like for them to bring those with them?
If there's a lot of them,
Yeah.
it's usually better either have them with you or a list of them.
And then coming in, I think about the convenience of not a long, terrible wait time, but you're getting patients kind of in and back very quickly, so maybe they're not sitting hours waiting around other patients with things.
Right.
Talk to me a little bit about that, because I guess medically compromised patients, that may be an issue.
Typically, the longest part of the wait period is filling out your new patient paperwork. And that's our goal, is that you're not really having to sit in the waiting room and be around other people. But now if you do come in with any symptoms of, flu-like symptoms, we do have masks at the front that we will ask you to wear.
And then you also do things like, what about someone that may need a physical and exam, for CDL license, things like that? You do those things here?
Yes, I am certified for DOT examinations, so we deal with a number of companies. I also take, personal drivers, self-employed drivers, and I'm able to fit them in same day usually, so walk-ins for those as well. By appointment works better.
Right. But you can get them in and get them seen about. And that's good too, because sometimes someone may need something like that, but may find out they need it quickly.
Yes, they do tend to sneak up on you whenever you have only 1 or 2 year certificates on those.
Right.
Which the longest time you can have is 2 years. So.
Okay. Well, you've got a lot of great resources right here, and the convenience of having it for patients is very self-serving for our community, so that's great. And again, I just want to reiterate, you see adults and pediatrics, which is nice, and you're open 7 days a week.
Yes.
That's great. Well, we're going to take a quick break. Stay tuned, and we'll be right back.
At High Energy Medical Weight Loss, everyone has different motivations to lose weight. Whether you have medical issues or just want to lose a few pounds, here are some of our success stories.
I have been pretty heavy most of my life as a child, all the way up and through adulthood. My mom had been on me about going to High Energy because she had went to High Energy. And so I came to High Energy, and I've lost 68 pounds and over 70 inches. It has been the best decision I've ever made.
Call or come by High Energy so we can start your own success story.
Welcome back. I'm now joined with Rhonda Brookard here at High Energy Weight Loss. Welcome to the show. And thank you again for letting us come into y'all's beautiful area here today. Now, High Energy Weight Loss, I know that you've been associated with that for a while right here, but you have a lot of experience in this field. Talk to me a little bit about that.
Well, we do. High Energy is not new in town. High Energy's been here for almost 17 years. But a little bit of history about me is I started as a patient. Never thought I'd be on, this part of it, but I started as a patient because I had done so many things to try to lose weight, and I would lose it and then gain back that plus more. Because I'd done the diet pill routine, I'd done the, the other programs around town and some things online too. And I could always lose weight, but I just couldn't keep it off.
So what makes this different than some of those things that you mentioned?
Well, I tell everybody it's always the same answer. It's everything is different. One thing is we're the complete program. It's a total program. It's not just losing weight, because most of us have done that. We know how to do that, but we help you with that. But also with transitioning food back into your plan. Back into your diet, and then we stabilize you at your goal weight, and then we go into maintenance. So it is the total plan. It's not just one thing or another, because we need to know what to do next.
Right, and we hear that it's a lifestyle change, but we don't know often how to get to that lifestyle change. And that's something you help patients with.
Absolutely, it is. Making sure that we have the right program to fit your lifestyle, and your budget, because we're all at different chapters of our life at different times. There's just me and my husband at home now. A few years ago, there was me and my husband and 2 children at home, and so we have different chapters in our life. Some people are retired; they don't know what to do. As far as preparing meals or going out to eat, but also you may be at home with a house full of children. So how do I do it there? So we help you with all aspects of the program.
And I imagine that falls in line with also you probably see patients that need to lose anywhere from 10, 20 pounds to maybe 100.
Absolutely. A lot of people, may think that we're just, because we're a medical weight loss program, that we're just for people that are sick. Of course, we can help you, if you're diabetic. Onset of adult diabetes is a lot sometimes related directly to your weight. So we can help you. If you have high blood pressure, we can help you. If you have other health issues, joint problems and back problems and all kind of problems like that, we can help you. But also, you may just need to lose 10 or 15 pounds because you got a class reunion coming up, or you want to go on vacation this summer and you want to look better in your clothes or in your swimsuit. We can help you there too. So it's not just for someone that's sick. Can also, like I say, if you have 10 pounds or 110 pounds to lose, we can absolutely help you here.
And you bring a good point. So day one, so let's talk about that, because many of our viewers may be at that spot in their life, like you mentioned, they've tried things, this didn't work, I kind of feel like I'm stuck, I'm in this rut. How do they get started? And is there a charge to get started?
No, there's not. And that's what we tell everybody, it's a free consultation. It usually takes about 30 minutes to go over everything with you, and we give you a total assessment when you come in to see how much weight you need to lose, but also what kind of lifestyle do you have now, so we can make sure that the program fits you. We have several programs here. It's not a one size fits all.
And when you talk about that, so you do things from, maybe it might be some medication therapy, maybe it's injectables. Talk to me a little bit about the difference.
Well, we have a total food-based program. It's all real food, and we have meal replacements here. We also do injections here, and all these things are tools. They're tools to help you reach your goal. We do injections here. We also have prescription medications here, so if that's something you want. So it really fits everybody.
Right, and with that convenience, so that comes with, you sometimes see patients, now for working people, it's very hard to fit this in our daily schedule. That's right. So you see patients early and late?
Yeah, we start seeing patients really early in the mornings, and then we're here till late at night, and that's okay, because that's when, most of our patients are, working people, and they have to come in after work. So, always call us, we can work you in, and, it doesn't take that long to do what we need to do. And when you come back for your visits, yes, you're going to be coming back for visits here. You don't need an appointment. You simply walk in, sign in, have a seat. Your wait time is usually about 5 minutes. Your visit time usually takes about 20 minutes, so it's very quick and easy, and there's not a long, drawn-out wait time here.
Okay, great. Well, I appreciate you taking the time to sit down with us. And if you'd like more information of any of the providers that you saw here today on Healthcare Today, you can log on to www.southernspinehealth.com, and we'll see you next time here on Healthcare Today.